fiber is the bread and butter for us. So I tell my patient is that every day, gastroenterology recommendation as well is that minimum 25 grams of fiber per day in women, 35 grams of fiber in men. What do you do in your practice?
I'm almost scared to tell you. Okay. See, Doc, I'll tell you very honest. I have read all, if not all, majority of the literature that is created in the form of studies, RCTs, meta-analysis. I follow, apart from you, a lot of people who are big on fiber and very legit, not necessarily with a bias to animal-based or plant-based, because those are very two different conversations. One side says no fiber. But I want to tell you, and when they come to me, they have and let's talk very specifically IBS, IBD, all the spectrum of IBS, IBD. In some cases, it is so bad. The medications give them heart palpitation. They have to go into the ER. They can't tolerate anything, malabsorption, all of that. So now, when people come to me, this is their line. I have done everything. I have had this condition for 2 years. My first question is, have you visited a doctor? Let me rule out. So I start with ruling out. I say, have you ruled out SIBO with a doctor, leaky gut? Have you ruled out H. pylori? Very common infection, which you cannot solve with nutrition. Okay. I rule out all of this. They say, yes, I've been to the doctor. I don't have this. I don't have this. The doctor said IBD. I have been on medication for 2 years. No matter what I do, it doesn't help resolve me. Now, I also know that as a gastroenterologist, it is hydration and fiber. I actually do the exact opposite, doctor. And I start my elimination protocol. The first thing I take away is raw vegetables. Because I believe that first I need to start letting the person eat something, feel better, give that gut a rest without those cramping and either constipation or diarrhea, and bring them back to basic baseline before I start reintroducing foods that will help them solve the root problem. And I do agree with you that they probably reach this state because of low fiber, and there could be 10,000 reasons. It could be bad lifestyle, it could be junk food, it could be sugar. In many cases, anxiety, mental health is related to, like a IBS condition. So when they come to me, it can be from, like, I'll tell you a case study later, but it can be somebody who suffered it for 10 years.
Yeah.
And they live with it, doc. They live with it, saying that, oh, today this happened, I'll pop this. Even further, we know what laxatives, antacids, they further destroy. We know that, you've spoken about it. They put a band-aid on it to the extent, but when they come to me, it's a very bad state that they don't know what to do. So I have to go the other way and say, let me first remove what irritants I know. And this is trial and error. Let me tell you, it is different for different people, because your gut microbiome is like your fingerprint. What I remove for you
will not be the same for me.
Same for me. But having said that, there are some commonalities. Okay. First is raw vegetables, because you need to have a really well programmed, diverse gut microbiome to digest anything raw. That is commonly known in nutrition and in circles of...
It's difficult to digest.
Very difficult to digest, because you have to have robust stomach acid and microbiome to handle that. We already know that there is compromise there. So the first thing is I take away anything that is raw. Okay, so take away that. And mostly vegetables. Then I will... Even before I take away raw vegetables, sugar, starch, junk food, excessive sugar consumption needs to go. Without that, I don't start this protocol, because I tell them that, one end I'm trying to resolve by removing fiber and doing things. Other end, if you're going to feed yourself bhujia and Coke every day, it doesn't work. So that is without a brainer that I drop that, and I tell them to go sugar-free for a very long time. So no processed sugar, not even in tea and coffee when it comes to that sensitivity. The next is raw vegetables. Third, I take away starch, because molecules of sugar that don't sit in that condition Ultimately, starch is molecules of glucose that don't allow to sit in that condition when the gut microbiome is that way. Okay, so a lot of sweet potato, a lot of that I take away. Okay, the third thing I take away, which is, I know you will not like it, but it is a third go-to, legume. Most people, the only thing that they tolerate in plant, especially in the lentil legume category, is all forms of moong. They are very good with moong sprouts. Again, not raw, cooked. Moong sprouts cooked, because a lot of people consume moong sprouts raw. The germination procedure actually can cause gas in a lot of people. It can cause flatulence.